Today we are going to discuss the phonological process of weak syllable deletion. First of all, a phonological process is a child's way or technique of simplifying adult speech. Phonological processes are typical for young children as they are developing speech, but in most cases they will eventually be able to produce the accepted pronunciation. Weak syllable deletion is a syllable structure process marked by the omission of the unstressed syllable of a multisyllabic word. For example, banana is a 3-syllable word. Each syllable within the word takes on a stress level, either strong or weak. For banana, the pattern of the stress would be weak, strong, strong. A child who demonstrates weak syllable deletion would omit ba and say nana. Weak syllable deletion is considered developmentally appropriate for children under the age of 4. If this behavior persists beyond age 4, it should be targeted in therapy. Although this is a fairly uncommon phonological process, it can become more of an issue as the child's vocabulary grows. Using more multisyllabic words, the occurrence of weak syllable deletion is higher because of increased complexity of words and phrases.
Now we're going to go through some examples of how a child with weak syllable deletion would pronounce multisyllabic words. The first example is the word potato. In potato, the first syllable is weak and the second 2 syllables are strong. So for a child with weak syllable deletion, they would omit the po and pronounce the word tato. Likewise for the word pajamas, there is a weak, strong, strong syllable pattern. So they would omit the syllable pa and pronounce the word jamas. For the word telephone, the weak syllable is in the middle. So the child would omit the la and pronounce the word telephone. Likewise with dinosaur, the pattern is strong, weak, strong. The child would omit the middle syllable and pronounce dinosaur, disaur. Now we'll look at some examples of how a child would use weak syllable deletion in sentences. In the first example, her name is Melissa. Melissa is the multisyllabic word with a weak, strong, strong syllable pattern. For this, the child would omit the first syllable and pronounce the sentence, her name is Lissa. In the second sentence, can I play on the computer? The word computer also has a weak, strong, strong syllable pattern. The child would omit the cum and pronounce the sentence, can I play on the pewter? In the final example, you can stand under my umbrella. The word umbrella is a weak, strong, strong syllable pattern. The child would omit the and say, you can stand under my umbrella.
When addressing the weak syllable deletion in therapy, it is important to note that it is a phonological error and not a misarticulation. An articulation disorder denotes that a child has difficulty with the motor processes that designate speech. But this is not the case of weak syllable deletion. Weak syllable deletion is considered a phonological disorder because it designates difficulty with the system and patterns of phoneme usage, not the pronunciation of the individual phonemes themselves. Returning to the example of producing nana for banana, a child with weak syllable deletion may be able to properly produce the B phoneme in isolation at the word level and sentence level. They omit the B in the word banana, not because of their inability to produce the sound, but because they are struggling with the prosody or stress and intonation of language and do not understand that that syllable is needed to differentiate between banana and nana. In summary, the child may possess the correct phonemes in his or her phonetic inventory, but omits them when they are present in the weak syllables of multisyllabic words.
For children who have a limited number of phonological processes, minimal pair therapy is a good technique to use. With this type of therapy, the clinician would select target words that differ by 1 syllable, thus creating relative contrasts in meaning.
That one?
Escape. Tape.
That one?
Leave.
Oh. you forgot a part.
Bleep.
Good job. Here's the other one.
Bleep.
Yeah.
Another type of therapy clinicians use in treating weak syllable deletion is metaphon therapy, which focuses on metalinguistic skills. The goal of the clinician is to increase the client's knowledge of word structure, specifically syllables. The first step of this therapy would be to develop awareness of the properties of syllables, and the second step would be implementing and practicing the knowledge the client has acquired.
Syllables are the rhythms in the words, kind of like beats in music. So we're going to clap our hands to the words, okay? We're going to start with baseball. Baseball has 2, so we're going to go baseball. Can you do that?
Baseball.
Look at this picture. Here's a boy. Can you clap the rhythm of that word?
Boy.
Good job. Now we're going to add to it this cow. Can you do cow?
Cat.
Can you clap that one?
Hat.
Good job, that one just has 1. So now when we put them all together, we need all 3 parts to make cowboy hat. Can you clap that one?
Cowboy hat.
Okay, now we're going to take turns. I'm going to say a word, and you're going to point to which one I say. And then you're going to say a word, and I'll point to the one that you say, okay? Mistake. Good job, that's right, that has 2 syllables. Mistake, remember? Okay, your turn.
Steak.
Said steak. Poo.
Poo. Shampoo.
Yeah, good job. You said shampoo with 2 syllables.
Another type of therapy is cycles training. This approach is typically used for highly unintelligible children who demonstrate more than one phonological process. Each process is addressed individually for a limited amount of time and in a cyclical order. Next, we will demonstrate therapeutic techniques for the weak syllable deletion cycle. At the beginning of the session, review the preceding session's word cards. Next, the clinician will model the target words for this session. This is known as auditory bombardment.
Banana, nana, escape, cape, shampoo, poo.
The child will then paste pictures of the target words onto index cards while repeating the words modeled by the clinician. The next phase of therapy is practice through experiential play. For example, place the target cards under bowling pins and have the child say the word when they knock the pins over.
Ooh, good job. You got 3 of them. Okay, can you come flip them over and tell me what they are?
Cape.
Well, can you try again?
Escape.
Yeah.
At this point, you would assess the child's stimulability in order to determine the target for the next session and send home practice with the client.
Leaving weak syllable deletion untreated could result in immature sounding speech and create misunderstandings in communication. These therapy techniques can help improve the intelligibility and effectiveness of the child's speech. We hope this information has been beneficial in helping you understand this phonological process and selecting therapeutic techniques for treating weak syllable deletion.